Are you having a migraine or a stroke? Know the difference. Head pain, blurred vision, confusion, lightheadedness. All are symptoms of both migraines and strokes, but not knowing the difference could cost you your life, a top doctor says. Ravindra Rajmeen, MD, a professor of medicine at NYU Langone Medical Center, tells Newsmax TV that stroke and migraine symptoms are often mistaken for each other. But while migraines will eventually go away on their own, with or without medication, a stroke can cause death within hours if left untreated. If you're an individual who has migraines and you experience a migraine attack that's a little bit atypical, I certainly think having somebody else evaluate you is a wise idea. He explains in an interview on Newsmax TV's Meet the Doctors program. If you're unsure because there are certainly stroke mimics, come to the emergency room and have a provider evaluate you. Strokes claim about 140,000 lives each year, which makes it a leading cause of death. A ruptured blood vessel that leads to bleeding in the brain is called a hemorrhagic stroke, which may require surgery. Strokes can also be caused by a blood clot, an obstructive or ischemic stroke, which can be treated with an anticoagulant known as tissue plasminogen activator, TPA. A stroke, simply put, is really catastrophic, a catastrophic event in the brain, Dr. Rajmeen explains. Think of it as a brain attack. There are different ways that the brain can be attacked, and it usually has to do with disruption of the blood flow to the brain, either from something that prevents blood flow in an artery that's usually an obstruction, or something that causes the artery to rupture. Typical symptoms of stroke include sudden numbness or weakness of the face, arm or leg, sudden confusion or trouble speaking or understanding others, sudden trouble seeing in one or both eyes, sudden dizziness, trouble walking or loss of balance or coordination, sudden severe headache with no known cause. Migraines cause intense throbbing or a pulsing sensation in the head. Other symptoms can include nausea, vomiting, vision disturbances, and sensitivity to light and sound. Migraines are experienced by 1 in 10 Americans. According to some research, migraines and strokes may be connected to each other. High blood pressure and cholesterol, heart disease, diabetes, and smoking are all conditions that could put people at higher risk for developing a stroke. Several strategies can reduce your risk of stroke: eating a healthy diet, maintaining a healthy weight, being physically active, avoiding tobacco, limiting alcohol use, and preventing or treating high blood pressure and diabetes. Dr. Rajmeen notes that strokes must be treated quickly or they can lead to significant brain damage, disability, or death. That's why it's critical to know the signs and symptoms of stroke. It's important for not only patients but also family members, kids, grandchildren to recognize these signs in older folks or actual at any age, because stroke can occur at any age, he says. And if there's a question and the patient has risk factors such as hypertension, diabetes, high cholesterol, certainly I would get that person to an emergency room to be evaluated by a provider.